We started carrying out the intra-articular ligamentoplasty under arthroscopy as it is a better procedure for anatomic reconstruction, and it brings with it a much better biomechanical outcome. It's also far less invasive. Our veterinarian, Dr. Krista Ulinder, has been practicing inter-articular ligamentoplasty under arthroscopy routinely here at the Animal Arthro Clinic for 20 years, and before that at another clinic for about 10 years. And over the last 2 years we haven't had any complications with this procedure. Now we perform between 100 and 200 CCL operations every year. When it comes to choosing and deciding on implant and tunnel size, we always take into account the dog's age. We have a good look into the joint itself and decide if it is a degeneration or trauma causing the problem. We think the advantage of our technique, as compared to other CCL surgeries which you'll find being used routinely in most practices, is that it provides a better procedure for anatomic reconstruction, also a better biomechanical outcome, and of course it is as non-invasive as possible. Regarding TPLOs or TTA operations, we prefer not to do those here at the clinic unless it is absolutely necessary, as it's a method we don't favour. We perform arthroscopic CCL operations on dogs that weigh at least 10 kilos and upwards, but there's no real upper limit. Where we don't use that arthroscopic technique in smaller dogs, the ones below 10 kilos, we would use an open technique instead. The dog is positioned in dorsal recumbency, and the leg is fixed in the leg holder so that it stays still throughout the procedure. The knee is hyperflexed to facilitate drilling and positioning of implants. A strict asepsis protocol is required. This surgery requires the Novatech surgery instrumentation kit, Novalig ligaments and interference screws. The size of the implants is selected according to the weight and size of the patient and their bones during preoperative planning, and might be adjusted during surgery.
And now you can see the cranial cruciate ligament, the rupture of the ligament. We change from medial to lateral with the arthroscope and feel the strength of the fiber, so we know for sure that it's and then we close the incisions with staples, and after that we do X-ray to check how the screws are positioned, and that's the end of the surgery.
When it comes to the post-op phase, the pet owner is given a weekly plan to follow, as well as a 6-month exercise program. And there are appointments with the clinic after 3 and 6 months where we carry out X-rays. We haven't had any issues in recent years that would make us need to operate again. But if there were any, we would probably remove everything from the joint in question and then make a further assessment before deciding on more surgery or letting it heal without implants. As we see it at the clinic, we are absolutely convinced this technology will be the dominant one within a matter of years.
On va dire que dans le cadre de la réparation des ruptures du ligament croisé, on est en train de passer une étape. Je pense que c'est quelque chose qui va s'inscrire dans l'histoire de la réparation du ligament croisé parce que ça va suivre à la fois une évolution qui est dans l'ordre des choses et puis un besoin sur le terrain, un besoin professionnel qui fait qu'on a besoin d'avoir des méthodes qui offrent davantage par rapport à ce qu'on a.